Hello everyone, welcome back to our channel CPC Adda, your one-stop destination for mastering medical coding concepts. In today's session, we are diving into one of the most important topics for your CPC exam, anesthesia coding. If you are preparing for the CPC exam or working as a medical coder, understanding anesthesia guidelines, modifiers, and anesthesia time reporting is crucial. So let's break it down by step. Stay tuned till the end because this is packed with insights you don't want to miss. So let's start with the basics. What is anesthesia? Anesthesia is the process of injecting chemical or anesthetic agent into human body which results in loss of consciousness and sensation is called anesthesia. Anesthesia, the process of injecting chemical or anesthetic agent into human body which results in loss of consciousness and sensation is called anesthesia. Okay, so now there are different types of anesthesia and as coders it's essential to know them. So what are the types of anesthesia? Topical anesthesia, local anesthesia, general anesthesia, regional anesthesia. Okay, topical anesthesia, local anesthesia, general anesthesia, and regional anesthesia. So what is topical anesthesia? Topical anesthesia means anesthesia apply through skin. Okay, topical anesthetics are medicines that numb and reduce the sensation of pain in the area to which they are applied. They are available in the form of ointments, sprays, lotions, creams, etc. Okay, topical anesthesia, anesthesia apply through the skin. Okay, topical route. And what is local anesthesia? Local anesthesia applying to particular area. Okay, local anesthesia is applying to particular area. So local anesthesia refers to using a drug called an anesthetic to temporarily numb a small area of your body. Okay, your doctor might use a local anesthetic before doing minor procedure such as a skin biopsy. Okay, you might also receive local anesthesia before a dental procedure such as tooth extraction. So unlike general anesthesia, local anesthesia doesn't make you fall asleep. Okay, so what is local anesthesia? Local anesthesia applying to particular area. Okay, so next, general anesthesia. Okay, let's see about general anesthesia. What is general anesthesia? Patient is not having sensation in full body when general anesthesia administered. Okay, this will happen majorly when they are performing major procedures. Okay, so patient not having sensation in full body. Okay, general anesthetics is a medical state. General anesthesia is a medical state induced in a patient to achieve unconsciousness and loss of sensation throughout the entire body. So it is typically used during surgical procedures to allow patients to undergo surgery without feeling pain or being aware of the procedure. Okay, general anesthesia is administered and closely monitored by an anesthesiologist or nurse anesthetist, and it involves the use of medications to achieve a reversible state of unconsciousness and immobility. Okay, in general anesthesia what will happen? Full body loss of consciousness. Okay, so next, regional anesthesia. So regional anesthesia again divided into how many types? 3 types. Okay, spinal anesthesia, epidural anesthesia, and nerve block. So spinal anesthesia, an anesthetic agent is injected in the subarachnoid space, okay, subarachnoid space into spinal canal for surgery performed below the upper abdomen. Okay, an anesthetic agent is injected in the subarachnoid space into spinal canal for surgery performed below the upper abdomen. Okay, below the upper abdomen. So what is epidural anesthesia? An anesthetic agent is injected in the epidural space. Okay, epidural anesthesia, anesthetic agent is injected in the epidural space through a small catheter, may be placed for a continuous epidural, and epidural can also remain in place after surgery to assist post-operative pain. Okay, so next, nerve block. So what is nerve block? Anesthetic agent is injected directly into the area around a nerve to block sensation, area around nerve to block sensation for the region the surgery is being performed. Okay, for example, using for any surgery in arms or legs. Okay, these are the types of anesthesia. What are the? Topical anesthesia, local anesthesia, general anesthesia, and regional anesthesia. Under regional anesthesia, again we have three types: spinal anesthesia, epidural anesthesia, nerve block. Okay, so now let's see about the services which are included in anesthesia, which are not included in anesthesia. Okay, so anesthesia included services. So anesthesia, administration of fluids or blood, this will be included in anesthesia service itself, and you no need to code separately for this. Okay, and some monitoring services also included in anesthesia. Okay, that is ECG or EKG, temperature, so temperature checkings, okay, BP checking, pulse oximetry, okay, BP checking, pulse oximetry, capnography, nothing but checking carbon dioxide level, okay, and mass spectrometry. So these services already included in the anesthesia service. So while coding anesthesia, if these services also performed, then you need to code separately for these things. Okay, you have to code anesthesia alone because these already included in anesthesia service. Okay, and now let's see some services not included in anesthesia. Okay, so those are not included in anesthesia. These procedures have to code separately. So that is central intra-arterial line, central venous line, Swan Ganj. Okay, these catheter placements not included in the anesthesia service. So while giving anesthesia, these services also, if they performed, then you have to code anesthesia service, that is 0 series code, and also this procedure code also you have to code separately because these are not included in the anesthesia service. For example, anesthesia service given and these services performed, BP check they did, or pulse oximetry, or capnography, or mass spectrometry, or EKG, ECG. Okay, if these type of services they did, then you no need to code separately for those type of services because already those are included in the anesthesia service. Okay, so anesthesia included services and anesthesia not included services you have to remember carefully because you may get direct questions from this area. Okay, so see, question will be like that. So which of the following is not included in anesthesia services, and they given 4 services. In this you have to find which service is not included in anesthesia. So that EKG, this is included, and capnography also included, and BP also included services only. Okay, so only CVAP to 4-year-old patient is not included, so this is the right option. So if they performed this procedure, you have to code separately for this. Okay. Next we'll see modifier 23. Modifier 23 and 47 we have to see separately in anesthesia topic. Okay, these are related to anesthesia, and we have given detailed explanation for these two modifiers in our earlier modifier classes, right? So here also we'll touch these things. So what is modifier 23? Modifier 23 is unusual anesthesia. What is that? Unusual anesthesia. So appended to anesthesia code only. Modifier 23 you have to use with anesthesia codes only, that is 0 series codes only you have to append modifier 23. So what is unusual anesthesia? Sometimes anesthesia not required, like if say few procedures not required general anesthesia, but due to some circumstances they need to give general anesthesia to perform that particular procedure. In most cases what will happen, if children or aged person, they will not cooperate to the particular procedure which is need to perform, and few people they might get excited, they might get anxious, like that while performing small procedures also. At that time physician are unable to perform that procedure, so they'll give the general anesthesia to get unconscious state for that patient, so that they can easily perform that procedure. Usually that particular procedure not require general anesthesia, but in some cases, that exceptional cases where patient not cooperating with the physician, they'll use the general anesthesia instead of local anesthesia, and they'll perform the procedure. Here, to represent that this is a unusual anesthesia, we have to add modifier 23 with that anesthesia code. Okay. So see the example here. Child or adult unable to cooperate with procedure requires anesthesia, that is CT, MRI, X-ray. The anesthesiologist should report the appropriate anesthesia code with modifier 23. Okay. So let's see modifier 47. What is modifier 47? Anesthesia given by the surgeon. Okay, right, anesthesia given by the surgeon. So what is modifier 47? It is anesthesia given by the surgeon. In some cases where there is no availability of anesthesiologist in particular area or in that particular hospital, there who is performing the procedure, that physician itself will give the general anesthesia. Okay, in that case performing physician itself given general anesthesia, so we have to give modifier 47 with that procedure code to represent that performing physician itself given anesthesia. Okay, so whenever anesthesia provided by the performing physician itself, you have to give modifier 47 with that procedure code. Okay, so modifier 23 should give with 0 series, right, with anesthesiologist service only, right. Anesthesiologist will give the anesthesia in some unusual circumstances where there is no necessity of general anesthesia, but due to some circumstances they will give the anesthesia to perform the procedure. So in that case you have to give 23 modifier unusual anesthesia with the 0 series code. This is anesthesiologist service. And modifier 47 is anesthesia given by the surgeon who is performing the procedure. So you have to give 47 modifier with surgery codes series 1 to 6 series. Okay, so 23 is 0 series and 47 is 1 to 6 series. Based on this also you may get the questions. Okay, so here see the question, which of the below is correct, and they given 4 codes with modifier. So here first option C 0 series and modifier 47. So 47 modifier should go with 1 to 6 series, right? So this is wrong option. And next option C 50500 23 modifier they given. So 23 modifier will come with which series? 0 series. So this is also wrong. And option C 0 series code with 23 modifier. So this is correct. And option D 1 series code with 23 modifier. So 23 modifier will come with 0 series codes, right? So this is also wrong. So in this case only option C is the right one. So like that also you will get the questions. Okay, so next we'll see time reporting, anesthesia time reporting. So time for anesthesia procedures may be reported as is customary in the local area. Anesthesia time begins when the anesthesiologist begins to prepare the patient for the induction of anesthesia in the operating room or in an equivalent area, and ends when the anesthesiologist is no longer in personal attendance, that is when the patient may be safely placed under post-operative supervision. Look carefully here. Okay, what they are telling, anesthesia timing. So always you have to see the start time. Okay, start time for anesthesia and end time for anesthesia. You have to identify these things in questions when they are asking about the time. Okay, so anesthesia time, when it will start? When anesthesiologist begins to prepare the patient for induction of anesthesia. So what is the induction of anesthesia? So anesthesiologist will go to the patient and he will start explaining what is going to happen there. Okay, when particular procedure is going to be done, first anesthesiologist will explain to the patient that so now we are going to inject the anesthesia, then you will get loss of consciousness, then we'll move to operating room and provider will do the procedure, and after some time you will get the sensation, and then we'll move to the post operative care room. Like that he will explain what is going to happen now. So that is induction of anesthesia. Okay, so that is the preparation of the patient for procedure. Okay, so when starting of this case, this particular thing, induction or preparing the patient, that time is start time of anesthesia. Okay, that is start time of anesthesia. And when anesthesiologist is no longer in personal attendance, when anesthesiologist is no longer in personal attendance, it means after completing the procedure, patient will transfer to post operative care. Okay, post operative care, patient will transfer to post operative care. Okay, so once this done, anesthesiologist will no longer required there and he will go. Okay, personally he will not be available after these things happen. So that is the end time of the anesthesia. Okay, that is end time. So what is start time? Preparing the patient is the start time, and when anesthesiologist no longer available, that is end time. When anesthesiologist no longer available, that is end time. So so start time and end time you have to calculate like that. Okay, So here you see an example. Anesthesiologist prepare the patient for induction of anesthesia to the patient at 9 a.m. Okay, 9 a.m. they started the induction of anesthesia to the patient, and surgery started at 9:15 a.m. Surgery end at 9:45 a.m. Then patient moved to recovery room for post-operative supervision at 10 a.m. Okay. Sorry. So what is the anesthesia time? So they are asking here what is the anesthesia time. So what we discussed anesthesia time. What is start time? Induction or preparing the patient is start time. Okay. And when person move to post operative supervision, that is end time, right? So here start time when it is anesthesia, induction started at 9 a.m. so this is the start time. So 9 a.m. is start time, and when moved to post operative supervision at 10 a.m. so 10 a.m. is the end time. So it means 9 to 10 only 1 hour, right? 1 hour or 60 minutes, right? This is anesthesia timing for this particular case. Okay, induction started at 9 a.m. and post operative supervision done at 10 a.m. So from here anesthesiologist will no longer available. Okay, so in between 9 a.m. to 10 a.m. is the your anesthesia timing for this situation. Okay, so that's it for today. Okay, so in our next class we will discuss about physical status modifiers and qualifying circumstances, and then moderate sedation, and also other anesthesia modifiers which are used in anesthesia topic. Okay, thank you, bye bye.